Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Severe acute respiratory syndrome, SARS. Introduction. Severe acute respiratory syndrome is a respiratory infection caused by a virus. It is also known as SARS. SARS was first reported in Asia in 2003. It spread worldwide over several months before the outbreak ended. SARS is spread mainly by close person-to-person contact. Frequently washing your hands with soap and water might prevent infection. SARS can be life-threatening. This program helps you understand SARS, including symptoms and causes. It also talks about the diagnosis and treatment of this infection. The respiratory system. SARS is an infection of the respiratory system. This section reviews the anatomy of the respiratory system. It also discusses the role of the immune system in preventing respiratory infections. The respiratory system is made up of organs that are involved in breathing. These include the nose, throat, larynx, trachea, bronchial tubes, lungs. The lungs allow us to fill our blood with oxygen. The oxygen we breathe is absorbed into our blood in the lungs. When we breathe in, the air goes through our mouth and our nose. From there it goes to the throat, also known as pharynx. The pharynx divides into two places near the top of the neck. It divides into 1. The windpipe at the front, which goes to the lungs. The windpipe is also known as the larynx and trachea. 2. The tube at the back, which goes to the stomach. It is known as the esophagus. From the windpipe, air goes into a number of increasingly smaller tubes called bronchial tubes. These are located on each side of the lungs. Small balloon-like sacs called alveoli are at the end of the bronchial tubes. The alveoli are very thin. Oxygen goes from the air into the blood through the alveoli. At the same time, carbon dioxide leaves the blood through the alveoli and goes into the lungs, where it is breathed out. The inner lining of the bronchial tubes makes a special substance called mucus. Mucus helps trap dirt from the air. Mucus is constantly expelled from our lungs. Very small brushes called cilia protect the respiratory tract. The cilia constantly push the mucus out of the lungs. Most of the time, the mucus is pushed automatically. If there is too much mucus, it can be coughed out. When the air we breathe contains germs, our immune systems protect the respiratory system from infection. Our body normally keeps germs from entering our lungs and causing a problem. Sometimes germs can get past the defenses of the respiratory system and cause an infection. Symptoms. SARS often begins with flu-like symptoms, including a fever higher than 100.4 degrees Fahrenheit or 38 degrees Celsius, body aches, chills, a general feeling of discomfort, headache. Some people also have respiratory symptoms at the beginning of the illness, such as a dry cough. Most people with SARS develop pneumonia later on in the illness. Pneumonia is an infection of the lungs. Pneumonia may cause difficulty breathing, unusually fast breathing, wheezing. Less common symptoms of pneumonia are chest or abdominal pain, exhaustion, loss of appetite, vomiting. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. SARS is caused by a type of coronavirus. Coronavirus is a family of viruses. It includes the virus that causes the common cold. The virus that causes COVID-19 is related to the coronavirus that has caused SARS in 2003, which is why the virus that causes COVID-19 is called SARS-CoV-2. Like most respiratory illnesses, SARS is spread through droplets. The droplets enter the air when an infected person coughs or sneezes. You can get SARS if the droplets land on your mouth, nose, or eyes. Close contact with an infected person can put you at risk for SARS. Examples of close contact are kissing or embracing, sharing utensils for eating or drinking, talking to someone within 3 feet, touching. The virus may also spread through contact with a surface or object that has been contaminated. This happens if a person touches the surface or object and then touches his or her mouth, nose, or eyes. Diagnosis. If you think you may have SARS, do not hesitate to get medical care. SARS can be life-threatening. Your healthcare provider may be able to tell that you have SARS based on your symptoms and a physical exam. Several lab tests are available to test for the virus that causes SARS. Samples of body fluids, such as blood or mucus, may be taken for these tests. Later in the disease, the lungs may also be checked for signs of pneumonia. Chest X-rays can show whether or not you have pneumonia. They can also show how severe the infection is and where it is located. If the X-rays are not clear, you may need a CT scan. Treatment. A severe case of SARS often requires treatment in a medical facility. It is important to limit contact with other people if you have SARS. You may be kept in isolation. There is currently no effective treatment for SARS. Scientists are testing possible treatments and vaccines. Treatments may be used to control symptoms until you get better. For example, keeping well hydrated helps loosen mucus. You may be given IV fluids to stay well hydrated. There are also antiviral medicines that can reduce the severity of certain viral infections. Unfortunately, these do not work well for SARS. If you develop pneumonia due to SARS, there are some treatments that may help. Antibiotics can be prescribed to fight the bacteria. Antiviral medicines may be given for pneumonia caused by a virus. Steroids may also be given. Steroids are medicines that can help reduce inflammation in the lungs. In severe cases, respiratory therapy may be needed. The goal of respiratory therapy is to help a patient breathe. Prevention. There are some steps that you can take to prevent getting SARS. This section discusses some tips to prevent infection. You can prevent SARS by following good hygiene habits. Cough or sneeze into a tissue and ask others to do the same. Do not share drinking glasses and eating utensils. Wash your hands often with warm, soapy water. Use alcohol-based gel for hand washing when soap and water are not available. You should also avoid close contact with people who are sick with SARS. SARS is spread easily through close contact. If you cannot avoid close contact or you are caring for someone with SARS, there are steps to take to prevent infection. You should wear disposable gloves when in contact with body fluids. Wear a surgical mask that covers your mouth and nose when in the same room as an infected person. You should also wash bedding, clothing, and utensils of an infected person in hot, soapy water. Use a disinfectant on surfaces or objects that may have become contaminated. To keep your immune system healthy and ready to fight infections like SARS, avoid smoking. Eat healthy. Exercise. Do not drink alcohol in excess. Reduce stress. Sleep well. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Severe acute respiratory syndrome, or SARS, is a respiratory infection caused by a virus. It was first reported in Asia in 2003. The infection spread worldwide over several months before the outbreak ended. SARS is spread mainly by close person-to-person contact. Frequently washing your hands with soap and water might prevent infection. Other ways to prevent infection are avoiding close contact with people who are sick, not sharing drinking glasses and eating utensils, eating healthy, exercising, and sleeping well. If you think you may have SARS, do not hesitate to get medical care. SARS can be life-threatening. Thank you for using Explain.